This method of adjusting the Andra gauge outside of the mouth is generally used when a predetermined measurement for sagittal, anterior-posterior, and vertical is established through a provider's preferred modality. These measurements may have been determined by radiology, anatomy, electrodiagnostics, pharyngometry, or other alternative sources. The sagittal is color-coded in gray. Dial in the sagittal position, if needed, by adjusting the gray pinion to the position determined by the preferred modality. The demarcations showing exact left or right millimeter adjustments are shown on the top of the exposed gray portion of the Andra gauge. The anterior and posterior adjustments are color-coded in blue. Dial in the anterior or posterior by adjusting the blue pinion to the position determined by the preferred modality. The demarcations showing the exact millimeter adjustment can be found in front of the blue pinion on the Andra gauge. The vertical adjustment is color-coded in purple. Dial in the vertical by adjusting purple pinion to the position determined by the preferred modality. The demarcations showing exact millimeter adjustment can be found above the purple pinion on the Andra gauge. Once all measurements are set, lock both vertical and anterior-posterior locking screws. Check to make sure all positions fit to your specifications by placing the Andra gauge in the patient's mouth. Once you feel comfortable with this placement, it is now time to add the bite registration material to the Andra gauge. If needed, apply a small bead of bite registration material into the gap formed by the maxillary and mandibular tooth cradles. Allow the bite registration material to set. This provides extra support between the upper and lower cradles of the gauge. Apply bite registration material to the upper portion of the bite fork. Apply enough bite registration material to compensate for the desired vertical position on the upper portion of the bite fork. Now apply bite registration material to the lower portion of the bite fork. Insert into the patient's mouth, upper teeth first, by aligning the center mark of the maxillary tooth cradle to the upper anterior tooth midline. Then have patient bite lower teeth into purple mandibular tooth cradle and hold until registration material sets. Have patient open mouth and remove Andra gauge. Now that you have obtained the best bite registration possible, simply send the entire Andra gauge with your captured bite registration to your preferred lab.